Okay, terrific. I think we're going to get started, folks. Welcome, everyone. Again, my name is Mark Schindler. I'm Executive Director of the Justice Policy Institute in Washington. I'm also a former Interim Director of the DC Department of Youth Rehabilitation Services, Washington, DC's Juvenile Corrections Agency. And I want to welcome everyone today. Just real quick, a bit of housekeeping. We're going to have time for questions at the end after our speakers. We'll ask you for questions from the media to please message your name and outlet in the chat function, and then we will unmute you for your questions. So we appreciate that. So we'll get started now. Again, I want to thank you all to this briefing about the risk of COVID-19 and how that poses severe problems in both youth detention centers and youth prisons around the country. We also know that that risk is not confined in facilities, but radiates out into communities. And there'll be some discussion of that today. I'll be moderating this discussion. I'm also a member of the Youth Correctional Leaders for Justice organization, a group of current and former youth corrections leaders who have issued a statement that I think you all have access to. It's available on the website. And that statement is from both current and former youth corrections chiefs from around the country, calling for the immediate and quick release of youth to protect them from COVID-19. If you look at that statement, you'll see two top line recommendations. We know, having run these facilities around the country, that even in the best of times, these are not the best places for young people. And so we believe that it's important to do away with large youth prisons and reduce the population of confined young people. That's extraordinarily true now, and we're in crisis mode. So we're calling for the release of youth from these facilities. As well, we're calling to limit as much as possible and calling on our contact with the justice system for young people and their families, and calling on our partners in the courts and the prosecutors around the country to join in that effort. And you'll hear from prosecutor today in that respect. So again, thank you for joining us in the interest of time. We're going to dive right in now. We have 5 experts with us who can offer their perspectives on what's happening with incarcerated youth right now around the country as we face this crisis. Each of them will be speaking briefly, and we'll be sure to leave time for questions. At the end, we'll open things up for questions from all of you. So we'll get started now. First up, we have Dr. Homer Venters, who is with us. He's president of Community-Oriented Correctional Health Services. He's an epidemiologist and a nationally recognized leader in health and human rights, particularly as it relates to having to do with correctional facilities. He's the former chief medical officer for the New York City jail system and the author of Life and Death in Rikers Island. Thank you for being with us, Homer, and I'll turn it over to you for your statement. Thank you.
Thank you very much. Thanks for the invitation to participate, and thanks to everybody who's participating as well. I think that in the last 2 weeks, we have seen a number of myths come crashing down about the ability to prepare for and adequately manage the arrival of this pandemic behind bars. I think that a month ago, as people were starting to sound the alarm bells for people with justice involvement, and youth included, a lot of people thought we could stop this virus from getting in, and once it gets in, we could manage its spread. I think that even in the last 72 hours, as we've seen more and more reports around the country, that myth has been shattered. This virus is inside communities all over this country and is spreading through those communities. And these places of detention, including juvenile and adolescent and youth detention spaces, are part of those communities. And the people who work there and who are held there are part of these communities, and they are becoming infected at alarming rates. I think that a couple of other myths I just want to address. One is that kids can't get very sick. Early on, we had this mythology in our country, and partly because it's a new virus, that young people won't get seriously ill. And I think that we have seen that that's not the case. We also know that we have many people inside these youth detention spaces that are disproportionately made up of people who have serious health problems that put them at special risk for serious illness and death. So we cannot proceed on the basis of a real misconception that people who are there, even if they get infected, couldn't die, because they can and they will. And so the other thing I would point out is that we have thousands and thousands of people working in these places who themselves are at very high risk. And so for them and for the people detained, obviously our first and most strident intervention, public health intervention, must be to get people out, to release, release, release. I think that the other panelists are much more eloquent and educated than I am about how to do that. But as a physician, having managed outbreaks in places of detention, that's the number one objective. The other thing I would like to reference is that we can't think or be confident that we will find sick people in these places. The way that these detention facilities are created and administered from a security standpoint means that there are often people who are getting sick outside direct vision, where we don't see them if they're in a cell or if they're in the corner of a dorm. We don't know what's happening. They don't have family members. They certainly have other people around them that can advocate for them and do, but we create a situation in these congregate settings where people will get sick, who won't know about it. The final thing I'll say about the clinical response is that I'm concerned that we are going to quickly overwhelm local hospitals with people who are coming from these places. And if there's anything we've learned, it's that people who have justice involvement really get a second and lower level of access to health services, especially when it comes to hospital admissions. There's logistics about escort officers or staff. There are issues in the hospital with how people are administratively received and where they're put. But we know enough to know that people have less likelihood of getting evidence-based care if they're coming with justice involvement. This is a horrible, horrible reality. So we have to get people out. And the final thing I'll say, each state needs to really commit to creating a coordinator, a high-level person who can coordinate the health care and health access for people with justice involvement, including youth. Right now, I see a lot of sophistication and coordination around long-term care facilities, around other parts of our society, but nobody in many of these states is thinking about how will kids in these places get access to the same level of care. It takes high-level commitment. So I'll stop and turn it over, but I'm really thrilled to be part of this group.
Thanks, Homer, for being with us today. It's really important to have your perspective, and I'm sure there'll be questions. Your point on the danger of local hospitals being overwhelmed is really important, and I think we're maybe even seeing some of that with news reports out of Illinois this morning. So thanks again for your comments and being with us. We'd like to we'll hear from Gina Womack next. Gina is the Executive Director of Families and Friends of Louisiana's Incarcerated Children. She's been working for a long time on these issues. She's been working most recently to close down Louisiana's Swanson and Jetson centers for youth and replace them with community-based systems of care. Gina's got a really important perspective to share with us, and thank you for being with us, Gina, and I'll turn it over to you.
Yeah, good afternoon or morning, depending on where you are. Again, my name is Gina Womack, and I am a co-founder and executive director of Families and Friends of Louisiana's Incarcerated Children. We are a multi-generational statewide membership-based organization, primarily working with parents and young people. Our organization, FLIC, works in a state with some of the worst outcomes for youth in all 50 states. We consistently rank at the bottom in education, poverty, and mortality rates, and we represent some of the most vulnerable communities of color. Our families are trauma survivors, so the very threat of a virus is destabilizing. Add that to the economic crisis, losing jobs, struggling to pay rent, all on top of fearing for the safety of their children. Ironically, 2020 marks 15 years since Hurricane Katrina. FLIC was about to begin analyzing, how are our children doing in New Orleans and the state of Louisiana as it pertained to education and the juvenile justice system when the coronavirus hit home. Having to recall our children that were left in prison when an entire city was on an evacuation order was all too painful to see. And it seems that we're pretty much in the same position today. Our elected officials here are making plans and moves for everyone in the state of Louisiana who are, except for the children who are locked behind bars, they seem to be an afterthought. Flick started a petition about a week ago demanding, we worked with Youth First and we sent the letter to all of our elected officials, and upon not receiving very much response, we did a petition demanding the safe release of children in youth prison. And we still haven't heard back. We didn't hear back from the letter. We still haven't heard back from the, in regards to them knowing that we're putting out a petition from the governor, and the response from the local officials are either random from jurisdiction to jurisdiction, and in lots of cases, they're just really inadequate. And it seems like there's really no plan in place of the outbreak in the youth facilities, and it seems as if Katrina never happened. Earlier last week, a New Orleans juvenile court was closed because 2 visitors tested positive with the coronavirus. The legal staff and the law enforcement working in an adjacent youth facility was most likely exposed to the contact. And the virus could spread like a wildfire in the closed quarters and unsanitary conditions of a juvenile detention center, which is, again, why we're desperately wanting to see these facilities closed. Medical care is already inadequate, and we know that they cannot, respond to a lot of the corona outbreaks. And so we know that a lot of the programs have been canceled. It's likely that no or any quality work around rehabilitation, counseling, or education is happening right now. I mean, a lot of our kids are sitting there and they're scared. On last Friday, we learned that 3 children locked in secure care tested positive for the coronavirus. And just a few days before that, the Deputy Secretary of the Office of Juvenile Justice resigned and was replaced by an attorney who 17-year tenure has been at the State Department of Corrections and included time as a deputy warden at the Diction Correctional Institute, which is an adult facility. And the only experience that we've seen that he has with children is that he's running a youth program. So that leaves us equally concerned. Secure detention is not simply secure. Our children have civil rights, and the very lives are being threatened. We have worked hard to fight youth solitary confinement because of the psychological and emotional harm it does, like you just heard. But this is only an avenue for quarantine in the youth prisons. And it could be a death sentence for some of our kids. Our children are already isolated from their families and their loved ones. Parents are wanting to hear more frequently from their children, but they get some phone calls, but phone calls cost money. Our families may be having to choose between feeding themselves and their household or calling and checking on their young people. We know that further isolation can be debilitating, and it could possibly lead to suicides. We cannot underestimate the potential harm of holding kids in detention when court dates are being postponed or canceled and without other advocates to support. It's being proven that children are not immune to coronavirus, and in many cases, incarcerated teens are more prone to health issues like substance abuse. They have asthma that makes them even more vulnerable. There was an article here that was released by the Marshall Project that was published about the young people who are spending time in prison. And one young person said to the school director that, "I do not want to die here, not in here." So releasing our children is the only way that we can ensure that this doesn't happen. And in one of our jurisdictions, a petition was sent out to petition the court to release the 22 children that are under their jurisdiction. The Chief Justice denied just blanketly releasing the kids, but he is working with seeing if he can do them case by case. So we're doing what we can to support the parents. We're writing letters of recommendation, and we're helping families who are already, afraid because, they want their children home, but they're also losing their jobs. and they're already victims of poverty. So we're really helping work with them and advocating for them because their futures are uncertain. And I think that's my time, so I welcome any questions. Thank you.
Thank you so much, Gina, for the work you're doing and have been doing, and for that perspective. I'm sure there'll be questions moving forward. So thank you again for your, what I know are just tireless and unceasing efforts. Next, we'll go to hear from San Francisco District Attorney Chesa Boudin. Chesa is a member of Fair and Just Prosecution, an organization of prosecutors committed to promoting a justice system grounded in fairness, equity, compassion, and fiscal responsibility. He can also speak from his own family perspective, having a father who's incarcerated during this time. So I'll turn it over to the district attorney from San Francisco, Chesa Boudin.
Thank you, Mark. Thank you, Gina. And thank you, everyone, for joining us today. As Mark said, I do have a personal experience with incarceration. When I was just 14 months old, my parents left me at the babysitter, and they never came back. That day, they were arrested for their role in a tragic armed robbery that left 3 men dead. My mother ended up serving 22 years in prison. My father is still incarcerated with a 75-year minimum sentence. As a result of what my parents did, I grew up visiting them behind bars. My earliest memories are going through steel gates and metal detectors just to be able to give my parents a hug. That experience profoundly shaped me and my understanding of what incarceration does to us as families, communities, and as a country. It's part of why I ended up becoming a public defender and now am San Francisco's district attorney. One of the issues that we're talking about today that is also affecting me personally is, of course, the COVID-19 epidemic and its unique impact on jails, prisons, and detention centers. My father's prison in upstate New York has already had at least 1 correctional officer test positive. So I think and worry every day about my father's health in a facility which, like so many jails and detention facilities, does not even have a single doctor on staff. The challenges that we all face in our lives and our communities are amplified many times over in the context of incarceration, and it's particularly true for young people. So let me turn to San Francisco's Youth Guidance Center, or YGC. It's a facility that it was built to have a capacity of 132 individuals that can be housed there. I'm proud to say that there are currently approximately 15 individuals that are housed there, between 15 and 17. And that is about half of what it was as of January or February. We've reduced the count since this epidemic began by nearly 50%. Now, that's both in response to this epidemic, and it's also because of a broader commitment that I and my office have to releasing youth who can safely be cared for in their homes and in their communities. We are curtailing new admissions and deferring prosecution when appropriate, while also ensuring that every single released youth has an adequate discharge plan and has essential supports in place to make sure that they can survive and thrive on the outside. The safety of the young people who remain in detention, the very few in San Francisco, during this time of crisis is an ongoing and daily concern for me and for my staff. We are committed to making sure that these young people are not kept in detention for any longer than is absolutely necessary. To that end, my office is in constant contact with the Office of Juvenile Probation, with the courts, with the defense counsel to discuss who's coming into custody and how we can quickly transition them out in a way that's safe and healthy and supportive. In light of the shelter-in-place orders that have been in place in San Francisco and in so much of the country, we've seen a drastic reduction in community services and placement options. Many of the traditional placement options have been shut down. And so we are working collaboratively and creatively in San Francisco to ensure proper release plans are in place that can adequately support young people while they're out of detention. This requires us to uplift and support families wherever and whenever possible as a primary placement option for young people. And it requires us to defer prosecution in cases where we can safely do so. We're making those changes. We encourage other jurisdictions around the country to join us in recognizing that, as so many public health officials have demanded, we must reduce the jail and detention populations right now. Public health depends on it, and public safety, in fact, depends on it. Happy to take questions as well. Thank you all.
Thank you, Chesa, very much for joining us today, and thank you also for your service, particularly during this time, and for sharing your personal insights in this of your father as well, and all others there. Next, I'd like to introduce Hernan Cervantes Martinez, who's with us today. Hernan is the National Youth Partnership Strategist for the Youth First Initiative. Youth First is one of the co-hosts of this press conference today. Hernan manages the Youth First Youth Leaders Network. Previously, he was a program analyst for the Bureau Center on Youth Justice. He's the recipient of numerous awards, including the Next Generation Champion for Change Award from the MacArthur Foundation in recognition of his work to improve youth justice systems. Much of his work springs from his own experience in the system when he was younger. Welcome, Hernan. Always great to have you with us, providing your words of wisdom. So I'll turn it over to Hernan now.
Awesome. Thank you, Mark, and to all the fellow panelists, and good afternoon or good morning to everyone. As I'm listening to everybody speak right now, I'm trying to bring myself back to a moment in time when I was incarcerated, where all of this, how this would have all felt in that moment. I was incarcerated at the time of Hurricane Sandy here in New York, and can still remember the anxieties that were running through my mind as newscasters were telling us how big that storm was going to hit New York. And even though I was 2.5 hours away from New York City, much of my experience during that time was just this hyper vigilant fear of knowing that I was trapped in a facility and I couldn't leave, I couldn't go anywhere. And I think what I'm trying to remember now is just, what did that feel like to me in that moment? Because I'm pretty sure young people right now in facilities across the country are experiencing that same level of just fear of knowing that they can't escape from this virus, especially if it goes into that facility. Most of the facilities that I visited while at my time at the Vera Institute, and even my own facility that I was at for 4 years, forced many of us to be in the same space 24/7. The only time that you would really be alone was when you were in your cell. And if you're in a cell 6x8, 24 hours a day, it gets a little intense to be with yourself all that time, and your mental health definitely is impacted by the need to have physical contact with people, the need to have the ability to talk to others. And right now, visitation for young people in facilities is, again, been completely cut off, and communication is getting much more difficult for my peers inside. And we have young people currently who are connected to the Youth First Initiative in Virginia, Connecticut, and Kansas who are currently incarcerated, and we're hearing the same thing. All of them are struggling with being able to connect to their families. They're struggling with this fear inside of the facility of not being able to keep that safe distance that the CDC is asking for young people and others across the country to take. And how can you do that in a facility where you're stuck in the same place, in the same space, where shared bathrooms is a thing, and where ultimately cleanliness is an everyday struggle? Because again, you're in the same space, you eventually run out of things to be able to keep cleaning in a facility-based setting where there's already a scarcity of things. And ultimately, the struggle to stay, in line with these CDC guidelines is nearly impossible. And so, as I think about what it's like to be in this space again, and bring myself back to that moment, I can't imagine not being able to go to school right now. I can't imagine not being able to play the only sports that I had to be able to cope through my time there, whether it was handball, whether it was basketball. All the physical sports that you can imagine, you can no longer do at this time. And in facilities, that's technically very few options in terms of how much you have to be able to cope. And so the pressure that young people are experiencing at this time, I can only but imagine right now. And if there's one thing that I would strongly urge anybody who sees this conversation is to remember a time when you, at some point or another, might have had to, spend severe amount of time in a room with nothing or anything or anyone to be able to connect to. And imagine a young person going through that at this time. Imagine a young person experiencing total social distancing on a whole nother level than the one we're experiencing right now in communities. We have the luxury of having access to people, have luxury of going to the deli and purchasing what we need. Young people in facilities don't currently have that luxury. They're trapped, they're not able to escape, and they're at the mercy of this virus at this time. And so if we truly are about our young people, if we're truly about public health and public safety, then we really need to understand that the liberation right now, or the, getting young people out of facilities is not an actual, let's free them all and let them run wild. No, we're asking that people release young people with transitional plans, with the proper supports in place, and ensuring that every young person has all the supports that they need in community. And I've heard the argument made that young people would be much safer in a facility right now than they would be in their communities because of the sort of conditions that they would be returning to. And I disagree with that. I say that because most of the resources currently are now trapped in keeping them in a facility that is, again, not supporting them in any way, and that ultimately was already causing them harm in 100 different ways. And so if we truly want to make a much more take a much more direct and staunch approach on supporting young people, we need to get them out. We need to make sure that the resources are there for their families and them, and making sure that these prisons no longer continue to hurt young people beyond this crisis, beyond this moment. Because at the end of the day, young people at this time need their families, need our support, and we need to free them at this time, especially in the middle of something that's happening. And it's sad to hear that it took a crisis for us to realize how much young people are going through in a facility-based setting. And so I urge people to continue to remember that as we continue to have this conversation. And I welcome questions at the end of this.
Thank you so much, Hernan, particularly for sharing your personal perspective and helping to paint the picture of what a young person is experiencing right now, today, already in a difficult circumstance, but now with what's going on, really lifting up both how that impacts mental health issues and things like that, as well as really pointing to the need for appropriate resources in returning young people to their families. So I really appreciate your sharing your thoughts with us. We're going to go now to our final speaker before opening it up to questions. I'd like to introduce my colleague, Vincent Schiraldi, who's co-chair of the Justice Lab at Columbia University, I should say co-director. Vinny is also co-chair of the Youth Correctional Leaders for Justice organization, who issued the national statement calling for the release of youth during this pandemic. Vinny ran and succeeded in both downsizing, closing a horrendous facility in Washington, D.C., and he can share his perspective from his insights as a youth correctional administrator. So I'll turn it over to you, Vinny, and thank you for joining us.
Thanks, Mark, and thanks for the work you're doing right now in terms of moderating this, but also your leadership in this space, and for all the speakers that went before me. It's just a really fascinating bunch of different perspectives. One thing I want to start by pointing out is that for a lot of doctors, public health officials, epidemiologists, we can look to the rest of the world for some lessons on what to do with the coronavirus as we start to plan public health approaches. We can't really do that with mass incarceration because we're the only ones doing it. So if you look at China, America has 5 times the incarceration rate of China, 6 times the incarceration rate of Italy. So we have to get out ahead of this in ways that other countries have not had to get out ahead of it, because the likelihood of our millions and millions of people who are caught up either in America's prisons and jails, our juvenile facilities, and on probation and parole, churning this in a way that's unprecedented is unprecedented. As a former youth corrections administrator, I know that my reaction, and I started to contact other colleagues in the field as I was drafting the statement that you now have, was one of a tremendous amount of fright and concern This will be, when it hits these facilities, an absolute nightmare to deal with. If anyone came on to this thinking kids would be safer in these places, they need to leave that at the door. Kids will not be safer in these places. These places are built to do the exact opposite of physical and social distancing. They're forcing people to congregate in ways that are known to damage their health, and they're doing so with an already medically vulnerable part of the population, a part of the population that has a lot of poverty illnesses. Kids, I remember, Mark, when we ran the juvenile facilities in Washington, D.C., kids frequently had asthma. The health of the young people in our care was way substandard to my own teenagers who were teenagers at the same exact time. So this is a medically vulnerable population we are forcing to be in congregate care in many facilities, by the way, in dormitory settings. So not just in congregate care when they leave their cells in the mornings. Some of them are in congregate care 24 hours a day. They are never alone. They don't have the kinds of hand washing and health available publicly. Healthcare is often substandard in these facilities. If you were to design a place that would magnify the dangers of coronavirus, you could actually hardly do better than youth correctional facilities in the United States of America. When we started gathering signatures for this, we have 32 people signed on that are youth correctional administrators from around the country. We got to 30 in 24 hours. So people out there that are running these facilities are scared for the young people. They're scared for their staff. What we're afraid is going to start happening is that staff is going to get sick. Their kids are going to get sick. Their families are going to get sick, or they'll just be afraid of getting sick in these places, and they'll start calling in sick and not coming to work. Programs are being cut in many of these facilities. Visitation is being cut in many of these facilities, and you're going to create an incredibly tense atmosphere with insufficient staffing, where staff will be ordered to work double shifts, and even then, there won't be a sufficient staffing complement. Homer's predecessor at Rikers Island, the current successor, I should say, at Rikers Island, the current doctor who is the chief medical officer, said a storm is coming, and a storm is indeed coming, and you don't want to wait to board up your windows till that storm hits. That's not when you take out the hammer and the plywood when the winds are at 80 miles an hour. You do it now. The young people need to be moved from these facilities and diverted from these facilities into appropriate post-release services, as Hernan mentioned. We need to be doing planning right now. This is what the youth correctional leaders have recommended. And we also need to be very careful to remember that there will be some kids left behind, and they need adequate health care, they need adequate programming, they need to continue to be going to school. They shouldn't just be sitting in the day room watching television. They need the ability to wash their hands, and they need good information and access to their families so that they're not freaking out while they're remaining behind in these correctional facilities. We can do this. Thankfully, America's juvenile incarceration numbers have declined by 59% since their peak in 1997. And while they've been declining, juvenile crime has gone down by 71%. In New York City, prior to the pandemic, we only had 60 kids in detention and 100 kids in placement, which meant that we had already substantially downsized from thousands in the mid-90s. And juvenile crime has continued to plummet even as we've done so. So these kids need help. Their families need help when they get out, but they can get out safely. And that is the ethical and medically indicated approach we should be taking right now. Thank you.
Thank you so much, Vinny, particularly for sort of ending on that sense of urgency that I know all the speakers share, reminding us that America is unique in this respect, and how many people we incarcerate, and the need to get ahead of this now. And of course, as we all know, we're talking disproportionately about poor young people of color in our facilities. And so this is a racial justice issue as well as it is a public health crisis in our youth justice systems. I think what we heard clearly from everybody is we need to act and act very quickly to significantly reduce the numbers of young people who are in these facilities to protect them and staff and the communities at large. With that,